Hello, thank you so much for joining today's presentation. My name is Dr. Reena Singh, and today's presentation is all about preconception care and why it is the most important thing you can do for your fertility and your family's health. All right, so thank you again so much for joining, and I am so excited to share this information with you. I have presented this information in a variety of ways previously, but this is the first time I'm doing kind of a full-on, full-length webinar, and so I'm super excited to share it with you. Okay, so before we begin, I thought that I might introduce myself to you because not all of you know who I am. And I just wanted to take a couple of minutes and kind of briefly tell you a little bit about myself so you know who I am, where I come from, what my background is, and why in the world you should listen to me. So I'm a naturopathic doctor, and I specialize in women's health, fertility, and preconception. And my journey into naturopathic medicine started with my own health disease. I was diagnosed with ulcerative colitis when I was 19 years old, which is a very debilitating chronic disease with not very fun symptoms. And so because of that, I was put on a lot of different medications, and I was told that I was going to have to stay on those medications the rest of my life. Well, I started having side effects, and so I had more medications given to me, and then more side effects. So I lived this life of this roller coaster ride of side effects and more medications for a few years. And I really didn't feel good about myself. I wasn't in a good place physically or mentally because of that. And luckily for me, I had the opportunity to move overseas. And while I was there, I got to work with a natural medicine doctor who, with his guidance, I was able to change my diet and take a few herbs and supplements and completely reverse my disease process within a short few months. And I was completely astounded that that was even possible. I had no idea. And so when I moved back to the US, I was so empowered to share this information with everybody. And so I decided to change my career and become a naturopathic doctor. And that's exactly what I did. And so I became a naturopathic doctor, and I had a general family practice for a few years, and I saw all kinds of different conditions and helped people with a variety of health issues and helped them to reverse their own disease processes, which was fantastic and so rewarding to be able to help people on their own journeys. But I've always had a passion for children's health and understanding and knowing that children's health starts with the mom and dad's health before conception. And so that's why I decided to specialize in fertility and preconception care and women's health, because I really wanted to help women and couples understand that there's so much they can do to help improve their fertility, as well as the health and development and future of their precious children. And so that is why I now focus on fertility and preconception care and work with couples who are consciously minded and understand that there's so much that can be done to help the life of their future families. So that's a little bit about me in a nutshell, and I don't want to spend too much time on me because I really want to get to the presentation and share all this great information with you. So let's dive in. All right, so I'm going to switch to the presentation, so just bear with me for a quick second. Okay, so hopefully all of you can now see the first slide, which says preconception care. And let's dive in. Okay, so before we can dive in, I do have to get the medical disclaimer out of the way and just let you know that this presentation is, of course, for informational purposes only, and for you to please consult with your licensed doctor for any medical questions, diagnosis, or treatment, and that this presentation does not establish any kind of doctor-patient relationship between you and me or you and Zama Center. All right, now that we got that legal mumbo jumbo out of the way, this is me again. I've already talked to you in person, so you could see me as I told you about who I am and kind of my history and what got me into naturopathic medicine. So let's move on. Okay, so we are here to talk about preconception care. What is it, why you should do it, and how do you do it? And so in order to start with what is it, why don't we start with the big picture? So here we have Sally and James, who dream of having a baby in the near future. They have been trying for a while, but haven't been successful. And they've kind of heard some things about preconception care and think that it's something they need to do, but they're not really sure what it is. So what is this preconception care and the time frame, and what does it entail? So in order to kind of understand what it is, let's first talk about these critical windows of programming and why that's important for a child's development. And so the preconception time is the time that is about 3 to 6 months prior to conception. And so these critical windows for programming refer to kind of these time frames in a child's health that impact their health their whole entire life. And so we know, of course, that the health of the mom during pregnancy can impact the baby. And so, of course, pregnancy is a critical window, as well as after the baby's born. So, of course, we know that that's important. But why is preconception so important? And in my opinion, it's probably the most important window for programming, if you will. And so, again, 3 to 6 months prior to conception is kind of the minimum amount of time that you want to think about preconception care. And so, why is 3 months the minimum time? So, 3 months is the absolute minimum time, because let's say the egg that Sally, our friend, is going to ovulate tomorrow. That egg that she's going to ovulate started on its journey 6 months ago. So 6 months ago, the egg kind of leaves its dormant, quiet, sleepy state, and it transitions into a more active growth phase. And then 3.5 months before ovulation, it really gets going in terms of its maturity and development. And so that's why the 3 to 6 month time frame is so critical for the egg and sperm development. And because that is the time that we have the most opportunity to impact the quality of that egg. And that is why it is just so important. Now, at the same time, we know that sperm takes about 3 months to get made. And so for men, it's important to know that the sperm that could fertilize the egg that's going to be ovulated tomorrow was made and produced almost 3 months ago. Okay. And so why is preconception care so important? Why have I decided to do like a whole presentation on preconception care? And this is the reason, this right here. We have an epidemic and just a huge issue of chronic health issues that not only impact fertility and pregnancy outcomes, but the long-term health of our children. So autism is, in my opinion, become an epidemic. Almost 1 out of 50 boys now will be diagnosed with autism. Neurodevelopmental disorders are affecting 1 out of 6 children. Childhood cancers is now a leading cause of death in young children. Allergies, ADHD, chronic illnesses, allergies, obesity, all of these have just become, uh, have increased greatly and affect a large percentage of our kids. As well as we know that recurrent miscarriages and preterm births are cause significant stress for a couple. But, like most couples, like Sally and James, who we're talking about, infertility is the main issue that they're concerned about. And that's all they care about. They just want to get pregnant. But my point is that we have an epidemic of other issues going on that are all related. And so infertility is just one of the many chronic health issues that our society is kind of dealing with today. And so when couples or a woman, chooses to want to get pregnant and maybe tries to follow a fertility detox or hears about a fertility tea that's going to help or takes herbs, and none of these work, and then maybe start considering assisted technologies to help with fertility like IVF and IUI, or maybe just some hormone treatments. And what I say to that is all those things may help to get you pregnant, but unfortunately, it leaves the window open for increased chances of all these other health conditions that we talked about, because the underlying foundation hasn't been addressed. And so infertility is just one of the many issues that not having a strong foundation can lead to. And what do I mean by that? So what is causing this eruption or explosion of chronic health issues? And in my experience and based on my research, this is what is going on. So our foundation is just being cracked wide open due to our environment, the GMOs and the toxins that we're exposed to, our diet, inflammation, stress, our poor digestion, and birth control pills. And so we're going to talk about all these areas in more detail. But this is really kind of the foundation in which and why preconception care makes such a difference, because it is designed to go in and reduce the impact of each one of these areas. Because at the end of the day, the goal is to optimize your health so that your sperm and quality are the best that they can possibly be. Because the information that gets passed on from that egg and sperm to your baby is going to kind of set the blueprints for your baby's long-term health. Okay, so this is an analogy that I love to use with people when we start working together, because I think it really helps to kind of give you the visual. And so it was kind of fun making this visual to go along with this analogy that I've been using for so long. But I always like to say that when you're building a house, you can't expect to build a house on a cracked foundation. And so all those squiggly white things at the bottom are the cracks in the foundation. And so this house is not very stable, right? Because they chose to try to build a house on a cracked foundation. And so just like you wouldn't try to build a house on a foundation that's not solid, you can't expect to build a completely new human being if your foundation isn't strong. And so asking your body to not only make a baby, but then build and nourish that baby for those 9 months, if the foundation isn't very strong, is a lot to ask of the body. And so this is really what preconception care is all about, is optimizing that foundation and creating the most solid foundation so that fertility becomes easy, But most importantly, we're setting the stage for babies' long-term health. And this really applies to anyone in the situation, whether they have been trying for a while and haven't been able to get pregnant, or they have had unsuccessful attempts with IVF or hormonal treatments. And so addressing the foundation is really the key. And that is what preconception care is all about. And the first phase in preconception care is really kind of cleaning up the environment, making sure that there's not junk and gunk that's clogging the system. And so the first area that we need to talk about is cleaning up. And why? Why do we need to talk about cleaning up? Well, the reality is we are exposed to a lot of chemicals and toxins in our environment and in our world. They are everywhere. We have 85,000 chemicals that are in use today. And we have 2,000 new chemicals being introduced into our environment every year. That is just mind-blowing when you think about it. And on top of that, the majority of these chemicals have not been tested on our long-term health and the effects that it has on all the different aspects of our health, and in combination with each other, which is frankly quite scary. Okay, so what's the problem? Well, 1 in 5 have fertility issues. Preterm births set the stage for lifelong increases in health conditions in children. Miscarriages, learning disabilities, and millions of IQ points have been lost. As well as we have this whole new phenomenon called kind of the disappearing male, or the feminization of genitalia, which is happening in our male babies. Our baby boys are basically not as boy as they once used to be. And this is correlated with numerous different chemicals that are in our environment and that mom and dad are exposed to before conceiving. And here's the sad reality. 100% of us will test positive for chemicals. They're everywhere, and all of us have a certain amount of chemical burden in our body. Over 300 chemicals have been found in the cord blood of newborn babies. 100% of nursing moms have toxins in their milk. And the placenta, which helps the baby to grow and nurse the baby for those 9 months, allows toxins to pass through. So it does not provide a barrier. It allows a lot of toxins to pass right through onto the baby. Okay, so here's kind of a visual of the burden of the chemicals that we're carrying. And really it's to show you that all our small exposures to various chemicals throughout our day-to-day life all add up and can absolutely impact the quality of our eggs and sperm, which then can lead to fertility issues and baby's development and baby's long-term health. And so let's talk about some of these chemicals that we're exposed to all the time. Artificial sweeteners are in so many things. The biggest one is aspartame, which hundreds of millions of people use worldwide, and it's in over 6,000 different products. I think diet sodas is probably the most commonly known one, but it's also in chewing gum, candy, desserts. It's even in prescription medications. And the research has shown that aspartame is linked to cancer and increased risk of cancer. And what they know and have said is that the earlier the exposure is to aspartame, the higher the increase in risk of cancer later on. So that's pretty significant. So the more exposure that we have to this aspartame, this chemical, can absolutely impact not only our health, but our baby's health. Pesticides have been studied a lot, and we know that pesticides can drastically reduce fertility, especially in men, but both men and women. And they've been correlated with autism and ADD and developmental delays, as well as emotional and behavioral issues in children. And so living near a golf course that is getting sprayed more often than other areas, or living in a community that gets fogged regularly with pesticides and insecticides for various things, and making sure that the pesticides we use in our house are appropriate. All those play a role in our body burden of these chemicals. GMOs and glyphosate. So GMOs are genetically modified organisms, and glyphosate is kind of the main ingredient in Roundup, which is probably the most commonly used pesticide around the world. And there has been a lot of research done between the link of glyphosate and GMOs and the autism epidemic. And we also know that glyphosate decreases progesterone levels. And so a woman's hormonal balance can be affected by eating foods that have these chemicals in them. Canned foods, receipts, and plastic water bottles, all of those contain BPA. And I know most people have heard about BPA, and it is a potent endocrine disruptor. And what that means is that it really goes in there and kind of messes with hormonal balance and exposes the body to more estrogen-like compounds. And what they have found is that in women who have have PCOS and have had recurrent miscarriages tend to have higher BPA levels in their system. So we know that BPA is associated with PCOS and miscarriages and decreased fertilization and implantation failure and reduced embryo quality. And here's a big one, the thyroid. So anything that affects the thyroid is going to impact fertility, and it's going to impact baby's brain development and development overall. So chemicals that affect thyroid function are really important to address, because they can impact not only fertility, but your baby's brain development. Okay, so moving on up. We use and are exposed to so many different cosmetics and soaps and deodorants and lotions and perfumes and hairsprays and all that kind of stuff throughout the day. And phthalates, which is the chemical that is found in many of those products, has been associated with children having lower scores in attention and having more aggression and ADD. And it has also been associated with this whole feminization of baby boys. So baby boys just having smaller penises, having abnormalities of the penis. And so it's a real issue, and we know that. Non-stick cookware is another big one. I don't think people realize just how much using those Teflon coated pots and pans have an effect on their health and their fertility, and it's important. So really, I just wanted to kind of show this slide as a visual to share that we all have chemicals. We're surrounded by them. And so the amount that has built up in our system can absolutely affect and impact our fertility for sure, but the health of our children. And that's why it's so important that cleaning up and getting these chemicals out of our environment and out of our system before conceiving is just so important. That's why it's really considered the starting point in any kind of preconception care program because of their profound effects. And those chemicals, what they do is they can absolutely impact the quality of the egg and the sperm. And that egg and sperm then sends information on to the DNA and chromosomes that are going to get passed on to the baby. And so, of course, we want to make sure that our eggs and our sperm are surrounded by a good, clean environment. Okay, so I know this slide is a little wordy, but it's really just to show you that there's a lot of research being done in this area, proving that chemicals have a profound effect on our health. And this one doctor, Dr. Grandjean, he is kind of one of the leaders in this area, and states that, you know, we have an ethical duty to protect the next generation, and especially the next generation's brains. And I really sincerely believe that we have to just be more aware of what we are exposed to, because that does affect our baby's health and brain development. And so I don't want to leave the men out. Toxins affect sperm too. It's just the way it is. And toxins really do cause oxidative stress and damage to sperm, which can change the quality of the sperm and also the counts of sperm. And so one day I'm going to do a whole webinar just on sperm health and what all the impacts of that make a difference in fertility and baby's health, because sperm is, of course, 50% of the equation. And so, yes, toxins affect sperm too. Okay, so now that we've talked about kind of cleaning up our environment and taking the time to reduce our body burden of these chemicals, and really I wanted to emphasize why, so that's why I went into some of the details of the specifics of how these chemicals derail fertility and affect children's health, because that is why it's so important to take the time to do that before conceiving. But the next big area is, of course, our diet, because food provides nutrition, and the nutrients is what provides information to our cells, to the sperm and the egg. And then that information is going to get passed on to the DNA that's going to get passed on to make your baby. So one of my most kind of, I guess, favorite guidelines that I like to always keep in mind and consider is that a successful pregnancy should not be primarily focused or defined by the outcome at birth, but also by the health status later in life. And this is so true. I think so many of us focus on just trying to get pregnant and doing whatever it takes just to get pregnant, without kind of stepping back to think how our health today can impact our children's lives later. And that taking just a few months out of our schedule now can really impact our child's life forever. Okay, so this is a study that was done on mice, kind of proving how and why diet makes such a big difference in the health of future generations. So these two mice are genetically identical. They are absolutely identical. However, the yellow fat mouse on the left, his mom was given a diet that was void of key nutrients that were needed to help methylate his DNA and make sure things were working correctly. And so now this poor little mouse is prone to obesity, diabetes, and cancer, all because his mom's diet didn't include the essential nutrients that she needed and therefore he needed. Whereas this kind of skinny brown mouse on the right-hand side, his mom was given a diet full of all the good stuff, all the key nutrients that she needed and was able to pass on to him. So he is thin and has a low risk of disease. And so we know based on research that the impact of mom's diet absolutely impacts the health that is passed on to our children. And that is why our diet is so important. So food provides information. Our diet provides key nutrients that are needed to supply our eggs and our sperm with important information. And this is so important for fertility, of course. And we know that a healthy diet full of nutrient-rich vitamins and minerals and all of the essential key nutrients plays a huge role in fertility, but also babies' long-term health. And it also helps to lower miscarriage rates and, of course, lower congenital defects and neural tube defects. And, of course, babies' brain development. So babies' brains need a lot of key nutrients. And if mom doesn't have those before conception, she's going to enter pregnancy with a less than solid foundation. And so it's going to make it harder for baby to kind of flourish and grow as well as he or she could. And so that's why it's just so important. So let's talk about, let me go back. Well, I'll just talk about some of the key nutrients really quick. But, you know, everybody's heard about folate, and of course folate is super important, but folate really also is important for egg and sperm quality and helps to prevent preterm births and miscarriages. And it's also associated with decreased autism risk. And so that's why it's so important to ensure that mom's folate status is really good before trying to conceive. Choline is another nutrient which kind of doesn't get the glory that folate does, but it is just as important as folate. And it also helps to prevent neural tube defects. And it's actually been found to help enhance memory. So you have the power or control to actually help your baby's memory throughout their lifetime. I think that's just fascinating. And then other key nutrients that play a role in fertility and in baby's development are omega-3s and iron. Iron is a big one. So a lot of women are iron deficient and or don't have optimal levels. And iron, low levels of iron is associated with premature births and language and behavioral delays in children. And it's really important for a good, healthy pregnancy and development in baby. Zinc is another one that's critical for both male and female fertility. And it's so important for, I think, over 100 different biochemical reactions in the body. And zinc is just essential. Iodine. Iodine is huge, and it is considered the single most preventable cause of brain damage and birth defects. And so iodine kind of feeds our thyroid. And like I mentioned before, we need a healthy, strong thyroid for fertility and for baby's development. And iodine, any kind of iodine deficiency has been associated with mental retardation and hypothyroidism and just baby's brain development. So iodine is super critical. And it's important to ensure that all of these nutrients, your levels are optimized before you try to conceive. And so here's a research article from the Journal of Obstetrics and Gynecology kind of stating that the majority of infertility cases due to ovulation disorders are preventable through modifications of diet and lifestyle. And so I just want to share these articles with you just to prove to you that there is tremendous amounts of research out there on the effects of our diet and our lifestyle and what we do in the preconception time frame that can absolutely impact fertility and baby's health and development. And so unhealthy diets in pregnancy have been associated with children to have behavioral issues, more tantrums and aggression. And this is what I like to tell moms to be, is that once you get pregnant, the baby is going to take everything he or she needs. And so if your tank is not very full and you don't have everything to give to the baby, then you're going to be kind of lacking because your nutrient status isn't very good. And that tends to create cravings for not so good foods. So more sugar and sweets and kind of not so good foods. And that is going to lead to an unhealthy diet during pregnancy. And the way to correct that or to fix that is to start changing and improving your diet and your nutritional status in the preconception time frame, because that is going to saturate your cells with all the good stuff and get your body used to eating nutrient dense foods, so that way you are already craving the good foods. So that way when you enter pregnancy, when you become pregnant, your tank is full. You're starting from a full tank, and so you have enough to give to the baby and still feel balanced yourself. And so that's why diet is so important, and it's critical to if you need to make changes in your diet, that those are done in the preconception time frame, because once you get pregnant, it's a little hard to make those shifts. Again, just wanted to show you that this is from the American Journal of Obstetrics and Gynecology again, and this was an article specifically on nutrition and dietary supplements in preconception care, and how it is so important for women of childbearing age to kind of maintain a good nutritional status before conceiving to help minimize health risks to both moms and babies. Okay, so now that we've kind of talked about cleaning up, so we know why we need to clean up our environment, and we also know and understand why we need to build up our nutrient status. We need to kind of saturate our cells with really good nutrients. Let's talk about some things that affect our nutrient status. And so it's so ironic, isn't it? So many women start birth control pills because they are trying to avoid pregnancy. And then when they decide they want to get pregnant, they stop the birth control pills and they can't get pregnant. They have such a hard time. And there's a reason for that. And that's what I want to talk about. Because there is a dark side to birth control pills. Birth control pills absolutely can affect fertility and later on baby's development. And here's some of the reasons why. So birth control pills actually decrease or deplete key nutrients that your body needs for fertility, for good, strong egg quality, for baby's development. And so if you've taken birth control pills for any length of time, and there are some women who've taken it for 15 years, and so it is so important to make sure that your nutrient levels are replenished, that you fill up that tank before you think about conceiving, because it is so critical for fertility and development. The next big thing it does is it really messes with the gut. And I don't think a lot of people know what this means and why it's so important. But your gut, your GI system, and the balance between your good and bad bacteria plays a huge role with getting pregnant. and hormonal balance and baby's development. And here's why: because your gut, the flora, the bacteria in your gut actually helps to metabolize and get rid of extra estrogens that are in your body. And it also helps to move waste through. So the gut flora and everything that the gut does is really critical to health, and especially fertility and hormonal balance. And so birth control pills actually kind of mess with that whole balance in the gut system. And that can lead to extra estrogen in the body, which can then lead to cysts and weight gain and irregular or heavy periods, irritability, and an overgrowth of bacteria and yeast, and basically can contribute to hormonal imbalance, which I think is quite ironic, because a lot of people start birth control pills to help fix their periods or help fix their hormonal imbalances, not realizing that one of the side effects of birth control pills is actually to mess with hormonal balance kind of indirectly by messing with the gut. So really important to know. And birth control pills also lower thyroid function. And as I've said a couple of times before, thyroid function is so critical for fertility and baby's growth and development. So anything that messes with thyroid function, like birth control pills and like chemicals and toxins that we talked about, are going to absolutely impact the thyroid, and which will then impact fertility and baby's growth and development. So this is kind of one of the other dark sides of birth control pills that we need to think about. And one of the last things it does is it increases inflammation in the body. And I always tell people, if your body has inflammation anywhere in the system, it's not going to make fertility a priority, because it's too busy trying to fight and figure out what this inflammation is for. So fertility kind of goes on the back burner. So anything that increases inflammation in the body is going to create a roadblock to getting pregnant. So this is why birth controls have a kind of detrimental effect on fertility and then baby's health. And one of the key reasons, one of the biggest reasons that I recommend a preconception care program for anyone who's been on birth control pills for any length of time, because there's so many things that have been affected in the body by these pills that need to be kind of fixed and balanced and just kind of brought back to baseline. And so trying to force a body to get pregnant that has been on birth control pills is not a good idea. It can have, I really believe it can increase the chances for just increased health problems later on in mom and in baby. And so that's why it's so important, if you've been on birth control pills, to take the time to rebalance all the effects that it's had on the system. And one of the other things that it does, which I should put here actually, is that birth control pills kind of mess with the communication between the brain and the ovary. And fertility actually starts in the brain. And so when we mess with that communication with hormonal signaling and communication between the brain and the ovaries, fertility is for sure going to get disrupted. I mean, that's the whole goal of birth control pills. They want to mess with the communication because they're trying to prevent you from getting pregnant. So just by stopping birth control pills, we can't assume that that communication is just going to come back online immediately. No, the effects of birth control pills can last for a long time after stopping them. And so that's why it's important to work on regaining all this communication and nutrient levels and the gut balancing before thinking about getting pregnant. So, okay, so that is birth control pills. All right, so the next big area that I want to talk about is stress, because a lot of people, I think, know and understand that stress plays a role with fertility, but I don't think they understand the other impacts that it can have on baby's development. So let's talk a little bit about stress. All right. Where do I start? Well, Americans are stressed. We are stressed out. 44% of people report that their stress has increased in the past 5 years. And 2/3 of all visits to the doctor are stress related. That is pretty profound, I think. So there are so many women out there who just dream of having a baby, and that's all they want, is to hold their baby in their arms. But managing work and life and family, it can create a lot of stress. And so the body, when it's dealing with all these other kind of stressors, won't make fertility a priority. And so that can be the hardest thing for a woman when all she wants is to hold her baby. So let's talk about some of the impacts that stress or too much cortisol can have in the body. It has a lot of different effects, as you can see here. I'm a visual person, so hopefully for you visual people, this is helping to kind of grasp the overview of what I'm talking about. But cortisol has a lot of different effects on the body, but specific to fertility, here's kind of the key points. So it definitely impairs fertility. It decreases libido, which is not great if you're trying to have a baby. And it also increases oxidation, which impacts the quality of eggs and sperm. And again, the quality of the egg and sperm is everything. That's going to impact fertility and baby's health. So how does this high cortisol impact fertility? Well, it alters how much estrogen, progesterone, and testosterone is produced. And this can absolutely affect hormonal balance and ovulation and getting pregnant. It can also reduce your uterine wall's receptivity to the fertilized egg. So even if you do conceive, like even if the egg does get fertilized and now you have a new little baby embryo that's trying to make its way down to the uterus to kind of implant itself for the next 9 months, it's less likely to in an environment that high cortisol is playing a role. And so that's important to know. That and this is actually one of the reasons that I think IVF and IUI and things like that don't have a very high success rate, is because we're not taking into consideration all these things that impact the uterine wall, the lining, and making it more, what's the word I'm looking for? So making it a good environment for that embryo to implant. And so that's, I think, one of the reasons that IVF and IUI are not as successful as they could be. So one of the last things it does is it also reduces critical nutrients for conception and pregnancy. And so, you know, like we said, birth control pills, we already know that they do that. And we know that chemicals and toxins also deplete our nutrient status. And now we have stress. So our nutrient levels are just kind of getting attacked from all different ways. And key nutrients are critical for fertility and a healthy baby. And so here are some of the key nutrients that are depleted, and all of these are important for fertility. Okay, so we talked about stress's impact on fertility, but now I want to talk about stress's impact on the baby and then the growing child, because I don't think a lot of people are aware that stress has a long-term impact. And the reason that I decided to research this in detail is because of my own personal experience. And my second baby was she was born, and she, for the first year and a half of her life, was a very fearful, kind of stressed out, anxious baby. And I was like, what is going on? What happened? I didn't understand at that time the impact that cortisol or stress would have on the baby. I just assumed that it would just affect me, but it's not true. Stress absolutely affects babies and children. And here are some of the ways it does that. It can contribute to language delays, motor delays, autism again, seizures, ADD, infections, autoimmune conditions, high blood pressure, and metabolic conditions. So stress plays a huge role in our children's health. And this is research that kind of proves that point, just stating that and showing that the effects of prenatal stress is passed across generations. So the stress that we have and the impacts of the stress on our body are then passed on to our baby, and our baby can pass it on to their babies. And so I just think it's profound that we have this information and research, and we know this now. And this is just another reason to ensure we have good hormonal balance before trying to conceive. And hormonal balance also includes our cortisol balance. So it's not just estrogen and progesterone. We have to also think about cortisol along with that, because high levels of cortisol in the body can absolutely impact our baby's development and long-term health. Okay, so I talked about why, because I think it's so important to understand the why before you do something. And this is what drives me. This is my passion and why I love working with consciously minded parents to be, that understand that their health absolutely impacts their fertility and their baby's development. You know, we are living in a state right now where we are just bombarded with chronic health issues. And I think every single parent to be should know this and should have this information so that they can take the appropriate steps before deciding to become parents to optimize their health and give their babies the best start possible. And for those couples who have been struggling with fertility, or maybe have had unsuccessful IVFs or IUIs, there could be reasons for that. And some of them could be, you know, what we talked about today. And so this is the reason why I feel like preconception care is the most important thing we can do for our fertility and for our baby's development. So before I get into, you know, what you need to do and what preconception care is, can I first just tell you what it's not? Okay, it is absolutely not just taking a prenatal and some folic acid tablets. This is absolutely not what true preconception care is. And I think there are a lot of people who think that is all they need to do. Just, you know, stop taking their birth control pills yesterday and start taking a prenatal and folic acid today, and then start trying to get pregnant next week. And I'm just shaking my head saying, no, this is absolutely not the case, because like I said at the beginning, it's so important to understand that the journey of that egg and that sperm that could become your baby started 3.5 months ago. And nutrients are so critical, but cleaning up the environment and reducing inflammation are super important and critical to do. And so yes, a prenatal is helpful, but it's definitely not the only thing. And a crappy prenatal is for sure not what is recommended. And the pictures here are of what I consider kind of crappy vitamins. And And one day I'm going to do a presentation on what makes a good prenatal and what doesn't, because I have analyzed quite a few of them, and it just amazes me that some of these companies, the quality of the nutrients that they put in their prenatal, it's shocking how bad they are, and that they are, I think they're actually worse for fertility. So, okay, so preconception care is not just taking a prenatal and a folic acid tablet. No. Okay, so then what is it? Well, in order to explain what it is, I want to share with you my second favorite analogy, which is getting, so if you were to think of planting an organic garden in your backyard because you wanted to grow organic vegetables. But that soil, you know, maybe wasn't ideal. There's weeds growing in it. It's kind of old. The soil is not optimal. So I'm going to imagine that you would take the time to kind of pull the weeds out, clean up the soil, and fertilize it, make sure it's getting all of the nutrient-rich ingredients that it needs so that the soil is ready. It's ready for that seed to be planted. So then when that seed is planted, it can flourish and grow. And that is exactly what preconception care is. It is getting that soil ready. It is replenishing the nutrients that may have been lost. It's optimizing all of the nutrients as well as the environment that those eggs and sperm are living in and what they're surrounded by. And especially for anyone who's been on birth control pills, anyone who may be getting into their mid to late 30s, anyone who may have had, who have been trying for a while and don't understand why they're not getting pregnant. All of these are reasons that preconception care is so important. It's like you need to kind of take the time to go in there and really nourish that soil. Make sure it's ready for that seed, for that little baby to be planted so then it can grow. So I hope that makes sense. This is one of my most favorite analogies, and that has always made sense to me. And I hope that helps to give you the visual. But that's what preconception care is. So I know you're just sitting there probably saying, okay, Dr. Singh, just tell me what to do already. What is preconception care? Okay. So number one, it is cleaning up and reducing inflammation. That is the first step. That is number one. So just like in a garden, you need to pull the weeds and you need to kind of reduce exposures to things that would create problems. And so reducing your toxic burden, exposure to all those chemicals that we talked about, helping and assisting your body to get rid of the toxins that are already built up in your system. That is step one. And eliminating things that create inflammation in the body. So foods that create inflammation in the body. There are 7 or 8 of them. The top 3 are, you know, wheat, dairy, sugar. That's a good place to start. And then really taking the time to go through kind of different areas of your life and all your different environments that you live in, and reduce the exposure to all these different chemicals that we're exposed to. And really thinking about and focusing on stress, because that does play a huge role and does contribute to inflammation, and does also depletes the body of key nutrients. So in that time, in the 3 to 6 months before you want to start conceiving, that's the time to start thinking about how to make your life easier, make cortisol levels be in balance. Okay, step 2. Step 2 is all about boosting your antioxidants and restoring the communication between the brain and the ovary. So now is the time. So we've cleaned up. We started the process of cleaning up. We've reduced inflammation. Also in step 1, we've also optimize digestion, because you want to make sure that you're digesting and absorbing nutrients properly, so that now in step 2, you're able to absorb all these key antioxidants. And antioxidants are critical for egg and sperm quality. And that is one of the biggest areas I feel is missed in most people's preconception programs, if they even offer one, is that they don't include key antioxidants that help to go in and really feed the egg and that sperm that is growing so rapidly. And so, especially in people who have taken birth control pills, have been exposed to chemicals, are older in life, because if we're older, we've just been here longer, so we've just been exposed to more stuff. So our antioxidant need is higher. And so that's what kind of step 2 is all about, is just flooding the system with key antioxidants so that our egg and our sperm are getting everything that they need. And the other big thing is, of course, restoring that communication between the brain and the ovaries. So anyone who's taken birth control pills, anyone who's had, who has PCOS, anyone who has hormonal imbalances, there is an issue with the communication between the brain and the ovaries, and this should be addressed. And there's different ways of doing this. I like to use homeopathic drainage remedies. That's what I like to use. That is what works, and so that's what I recommend, and that's what I use. But that's important to keep in mind. So restoring the communication between the brain and ovaries can take a couple of months. So if you've been on birth control pills, or if you have PCOS, you are going to have to do a few months work of getting the brain to start talking to the ovaries again, so they can start communicating, so that hormones are released at the right times and at the right amounts. Okay, and then kind of the third phase, or the third step of any good preconception care program, is to flood the system with key nutrients that your body needs to optimize the health of the egg and sperm, and also to make fertility a priority, that the body now says, okay, everything else is in check. Fertility is now a priority for me again. Because, the ultimate goal is, yes, of course, to get pregnant, but the ultimate goal is to make the healthiest, happiest, smartest baby that you possibly can. And it's important to know that it's in your control. It is up to you. So your health and dad's health and mom's health absolutely impacts baby's health and how easy it will be to get pregnant. And so that's what I hope you take away from today's presentation, is that it's in your control. If you have been struggling with fertility, or if you have had unsuccessful IVF or IUI, and if you haven't taken the time to address some of these foundational issues, then my recommendation would be to take a step back and to invest in a preconception care program that is going to help you optimize your health kind of bottoms up, like starting ground up, and really ensuring that your foundation is really strong, and that you're coming from a place of solid nutrition and a clean environment, so that your body can make fertility a priority. And especially if you have been on birth control pills in the past, if you do have, or if you have had unsuccessful attempts at fertility, or you've been trying for a while, then it might be a good idea to have somebody help you and kind of work with you to figure out what is going on and overcome those roadblocks, and then transition into a preconception care program. So that is my recommendation for you, for everyone. And my final thoughts: being a parent starts before conception. I really feel like we no longer live in a day and age where we can just decide to get pregnant and then hope and pray that our children come out healthy and strong and keep our fingers crossed. I don't think we live in that day anymore. I think we have to take action beforehand and do everything that we can to help optimize our health so that we can get pregnant easier and have the healthiest, smartest, happiest baby we can. Because there is an abundant amount of research showing that what we do in that 3 to 6 months before we conceive has profound impacts on getting pregnant and the health of our children. So I want to thank you. Thank you so much.